about the difficulty that it poses in these orphan patients that you mentioned, people not having family doctor. And Dr. Costello, you mentioned that 2,500 to 3,000 people out of a population of 14,000. That's about 20% by my awful math.
Oh.
How is that? How does that compare to places in the province? Is this more or less? Do you know?
Perhaps.
Yeah, I don't know the answer myself, but I do know that as an ongoing, continuing problem. And in the western region, there are quite a number of patients that are orphan patients. And if we see them, for example, somebody has broken their hip or has some specific trauma, these patients a lot of them do not have a family doctor that we can discharge them to. So it's a growing problem across the province.
Most of these patients, these 2,500, we've had a little mini economic boom in the last 2 years, and now it's starting to take off again. And a lot of these 2,500 patients, the majority of those are people who have relocated to our area. Some clinics, there are several physicians who don't look at statistics of doctor-patient and what the ratio should be, and their clinics are extremely busy. Other physicians have kind of set the limits of the number of patients they'll have in their clinic, and once that happens, the clinics are basically closed. So these patients will come to emergency for their ongoing care, for their investigations.
There is the issue of the orphan patient, but I think in rural Newfoundland in general, the even more common scenario is the patient that has a physician attached to them, but because that physician is so overburdened and so overworked by the volume that they have to take care of, they're not able to get in to see their physician for 2 weeks, 4 weeks. I've heard 6 weeks. You know, I have a patient show up in the emergency department for a refill of their blood pressure medication because they could not access their family physician for a month.
And we do know that we're short at least 100 family physicians in the province, so this is putting an additional strain on the whole system.
So the solution, outside of the infrastructure issues that you've referenced, the solution would be a competitive wage to most of your problems.
We need to be competitive so that we can entice people to come to our province. And we know that not everyone wants to come to Newfoundland and Labrador, but we want to attract the people who want to come to Atlantic Canada. We're not looking for anything as Ontario and Alberta are receiving. We're looking to be on parity with Atlantic Canada. And if doctors want to come to Atlantic Canada, then we would hope that our situation is competitive enough that they would like to come to our fair province in Newfoundland and Labrador. If you look at the statistics, we turn over about 100 doctors every year, and some people argue that is slowing down, but it's still a fact that we continue to turn over 100 doctors each year. We rely heavily on our IMGs, or international medical graduates, of which there's 42% in the province. We do know that they come to get trained themselves, and once they've completed their training, on average, they're in the province for 22 months afterwards, and then they move elsewhere. And the thing about that is the continuity of care for the patient. I mean, I live in Corner Brook. I see patients from out around Stephenville, St. George's, and it's a major concern for the patients that they go in a couple of times and see a different doctor on each occasion. And they become distressed by that because they don't feel they're getting the continuity of care for the problems that they have.
Okay. Thanks, everybody.
Thank you.
Thank you.